sir. We have ended our session 1 and now we will start the session 2. In session 2, we will discuss about the COVID-19 and its homeopathic intervention. In this session, we have our respected speakers, Professor Dr. Shubhashish Ganguly, Professor Dr. Shubhamoy Ghosh, Dr. Ognibho Sengupta, and Professor Dr. Milan Sengupta. Our first speaker is Professor Dr. Shubhamoy Ghosh.
We know that Professor Dr. Ghosh, working at the capacity of professor definitely, and head of the Department of Pathology and Microbiology in DNB Homeopathic Medical College and Hospital, Government of West Bengal. He is a guide of West Bengal University of Health Science, also the investigator of an ongoing research project of West Bengal Science and Technology, Department of Science and Technology of Government of West Bengal. And this project is going on in Moise Bhattacharya Homeopathic Medical College and Hospital. Professor Ghosh has already published his research paper in various prestigious peer-reviewed journals all over the world. And actually, he is also the mentor of and reviewer of different prestigious journals. I'd like to invite him for his presentation. Professor Ghosh, please.
I like to sincere thanks and divine love to the members of Homeopathic Education and Research Foundation, especially Dr. Milan Sengupta, who is I think the leader of this project. And this is very important nowadays. Dr. Milan has already think about integration of education into research, which is the need of the hour, need of the day in homeopathic medical fraternity. So this is the very good venture to start up Homeopathic Education and Research Foundation. Today's webinar has been dedicated to Dr. Hahnemann because it is a very good gesture, because Dr. Hahnemann, in the field of medicinal chemistry, he is the king. Most of the people do not know in the field of medicinal chemistry and the drug discovery that Hahnemann contributed in his lifetime he discovered about 100 drugs during his lifetime. It is a tremendous contribution in the field of medicinal chemistry. It is our very unfortunate in the field of medicinal chemistry. Hahnemann is ignored, but his contribution in the medicinal chemistry and the drug discovery is tremendous. So I bow to Dr. Hahnemann. I bow to the followers of homeopathy, and I bow to all teachers and faculties and students of homeopathy field. So today's session is dedicated to COVID-19 because we are suffering from the pandemic. We like to just free from this pandemic. So I like to share my presentation. Yes, Dr. Milan, I like to appreciate you that you are encouraging the new and budding students, those who are the future researcher, future presenter, future teacher. So that is very encouraging for students also. Yes, I like to share my PPT. Just a minute. So, role of double mutant variants of the SARS-CoV-2 in COVID-19, second wave, and the possibility of third wave. So, you know very well the exponential growth of affected individual led the World Health Organization to declare global pandemic on 11th March 2020. So, duration is about 14 months onwards. We are suffering from this pandemic. This is the scenario of epidemiology in India and West Bengal. So, electron microscopic picture of the coronavirus. It is a RNA virus, and with crown-like structure outside. Coronavirus are made of 4 structural proteins, namely the spike, the membrane, envelope, nucleocapsid protein. The spike protein is seen to be protruding from the viral surface, and it is the most important one for the host attachment and penetration. And this protein is composed of 2 functional subunits, that is S1 and S2, among which S1 is responsible for binding to the host cell receptor, and S2 subunit plays role in the fusion of the viral and host cellular membranes. This is the structural biology. And AC2 has been identified as the functional receptor for the SARS-CoV and highly expressed on the pulmonary epithelial cells. And it is through his host receptor, the S protein binds initially to start host cell invasion by the virus. And after binding of the SARS-CoV to the ACE2, the SARS protein undergoes activation via the 2 steps protease cleavage, and leading to the viral and host fusion. See, what is actually happening in the COVID? We are concerning about 2 or 3 things. One is the acute lung injury. This is a very, very big thing. Second is the cytokine storm. And third is the very lung fibrosis. 3 things are concerned. It's a very important thing to deal with. So why there is a surge of pre-existing disease? Why there is a second wave? Why there is a mutation? Why there is even a double mutation? And antigenic drift and shift, what is already, it is very much prevalent in influenza virus. Why all these things are happening? Why 3 could be, why there could be the third wave, and what will be the solution? In first wave, we know the devastating scenario of first wave. We are not concerning. It is a very new for us, because the novel virus, the full-blown symptoms are produces in the human host. That is the beauty of this virus. Full-blown symptoms like flu-like symptoms are seen in the human host. And what are the danger? Danger was acute lung injury, dangerous for the cytokine storm, and danger was lung fibrosis. And what is the mechanism of lung fibrosis? That is very, very important. Is what is the pathway? That is the possible pathway. Is the very important one. Is the lung fibrosis is the upregulation of transforming growth factor beta expression, while downregulation the level of SARS-CoV receptor AC2, and the decreased AC2 expression leads to high angiotensin 2 level, which further enhances TGF beta level. And TGF beta activates SMART protein via receptor mediated phosphorylation and stimulates SMART dependent gene transcription, which is facilitated by N protein, SARS-CoV and angiotensin 2. Both the TGF and SMAT and the ACE2 angiotensin 2 and pathways contribute to the myofibroblast activation ECM accumulation. That is the very important to produce lung fibrosis. In influenza, it's a very, very common is the antigenic drift, antigenic shift. So that is the mainstay of the variant of the mutation. Here is also, that is an antigenic drift and antigenic shift. Here double mutation is antigenic shift and antigenic drift. So new viruses may produce this mutation. Antibody recognizes the spike protein and kills them. Novel coronavirus D164G. Antibody recognize few of the spike protein and kill only few of them which are well recognized. Mutated UK B117 South Africa and Brazilian, which is very dangerous one. Antibody cannot recognize the spike protein, so they escape the body immunity system, avoid the defense mechanism of the body. So second wave. Second wave starts from the 15th February 2020, and second wave will stay for approximately 100 days. And what are the negligence and relaxation after the downfall of the first wave? That is the upsurge of the second wave. And no primordial prevention has been taken, especially for those who are having comorbidity. And lack of testing and early detection, overcrowding and instead of isolation, failure of preparedness for mass immunization, that is very important, and mutation of the virus to become more potent to produce new pandemic. So modified themselves to escape immune system of our body. Change to a better quality life more means kill more. Invite opportunistic infection. We have already seen in second wave, that is the mucormycosis and aspergillosis. So these type of fungal infection are very opportunistic one, because already to treat this COVID cytokine storm, modern medicine are using methylprednisolone and corticosteroid indiscriminately. They are induces this mucormycosis and aspergillosis. And simultaneously, don't forget about diabetes mellitus. India is a capital of diabetes mellitus. So triangle is COVID-19, apex is COVID-19, and another one is corticosteroids, and another is diabetes mellitus. This leads to the upsurge of this opportunistic infection. So pan-India, I'd like to hurry. As on date, consortium has achieved its initial goal of completing the sequencing of 1,000 SARS-CoV genome from nasopharyngeal and esopharyngeal swab collected from individual testing positive for COVID-19 by RT-PCR. The samples were collected across 10 states covering different zones within India. Given the importance of this information, public health response initiative, investigation, transmission the COVID-19, the sequence that data will soon be released in the public domain. So initial results indicate the multiple lineage of SARS-CoV-2 are circulating in India, probably introduced by travel from Europe, US, and East India. In particular, there is a predominance of A2A haplotype with D614G mutation, which is found to be emerging in almost all regions of the country. This is particular haplotype is globally reported to be associated with enhanced transmission of the efficiency. So see, the studies related to COVID-19, there are near about clinical trials of 281 and RCT 159 are already conducted. So CCRH already advocated arsenic album 30 in the first wave, and in the second wave, they have already provided us a guideline for treatment as well as prophylaxis. They have recommended arsenic album 30 in second wave also. And already in the fundamental biology, they have showed the arsenic trioxide, the pathway of the arsenic trioxide, and the paper has been published in the peer-reviewed journal. And one thing very important, the consensus from the different clinicians, they have advocated BRYONIA ALBA, which is a prime importance during the second wave. they have advised BRYONIA ALBA during the second wave. That is very important. The consensus of the clinician, and we have to perform the clinical trial in a robust manner, so that we can conclude that BRYONIA ALBA is a good prophylaxis or immune booster for the second wave. In the meantime, we can share one thing, one paper in 2017 in CCRH journal in IGRH, Umesh B. et al., who has published an anti-inflammatory homeopathic drug dilution restraint lipopolysaccharide induced release of pro-inflammatory cytokines in vitro and in vivo studies. So that is a supportive paper for BRYONIA ALBA, that BRYONIA ALBA may help as a very good in second wave to minimize inflammatory process which is occurring during cytokine storm. And we have to treat our COVID patient as the principles and guidelines of homeopathy. There is no specific drug will be introduced. So what in the third wave, that is a very important thing. We are concerning about third wave. Epidemiologists they are forecasting the third wave will come around October 2021, and the main victims will be the pediatrics group of the childhood sufferer. And the very interesting one, the third wave may affect the cognitive power of the individual. That is a very important scenario of the virus. They may affect the neuropsychiatric illness and cognitive ailment of the individual. So that is the new one, and more and more opportunistic infection like aspergillosis, mucormycosis will be evident during the third wave, because indiscriminately using corticosteroid may upsurge this type of infection. Thank you. This is about all my presentation. Thank you, Dr. Milan, for inviting me.
Thank you, Professor Ghosh, for your nice presentation. It is Professor Ghosh wonderfully explained and described the medicinal chemistry and drug discovery, these two things which is implemented by your master in homeopathy. We know his topic was the role of double mutant SARS-CoV-2 in second wave and possibility of third wave. In this matter, Professor Ghosh nicely explained the structure of the virus, not only that, the role and extension of pathogenicity of double mutant variants, as well as why the double mutant virus formed through its genetic drifting. Not only that, its pathogenicity in second wave of the COVID, it has been observed that there's a more acute lung injury, cytokine storm, as well as severe lung damage, which is prevalent. Apart from this, he also depicted the second wave, why it is more dangerous than the first wave. And as well as he also explained nicely about the third wave, and due to irrational use of medicines, whatever may be the medicines, that may be the modern medicines, that may be the alternative medicine, whatever may be the medicines, that may produce some ground of opportunistic infection, because it jeopardizes our immune system. So, Professor Ghosh, thank you once again for your nice presentation. Thank you.
I would like to welcome our next speaker, Dr. Ognivo Sengupta.
It's a great pleasure for me to introduce our speaker today, Dr. Ognivo Sengupta. Rajasthan University of Health Sciences. After that, he completed Master of Public Health from Macquarie University, Sydney, Australia. Now he attached with the Respiratory Division at the George Institute for Global Health, Sydney, Australia. Today his presentation, the topic, Impact of COVID-19 on Public Health in Indian Context. Now, welcome to our speaker, Dr. Ognivo Sengupta. Please continue your session.
Thanks for the lovely introduction. Can everybody see my screen?
Yes, visible.
Yes.
Great.
Visible.
Thanks. Okay. All right. I'm presenting on COVID-19 and its impact on public health and Indian perspective. It is a very general and holistic view of the impact we are currently going through and have been going through since the last 1.5 years. So to begin with, what is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, as has been written in the preamble of WHO Constitution. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. And health is actually much more than the presence or absence of disease. It reflects small things such as lifestyle, our behaviors, the environment around us, culture, socioeconomic conditions, and the availability and quality of healthcare programs and services that we can enjoy. So the introduction is as follows. COVID-19 is, as we all know, is an emerging infectious disease with its first outbreak in Wuhan city of China. The WHO on 30th January 2020 declared the outbreak as a global health emergency. So infectious disease epidemics have tended to have spillover effects onto the wider economy. So that means that they don't only have effects which are concentrated to ill health, but which affects the community and the society in the long term. In order to curb the spread of the virus, quarantine, self-isolation, and social distancing rules were imposed. So studies have showed that impacts of the pandemic extend beyond health to encompass adverse effects on household incomes, individual livelihoods, interpersonal relationships, coping skills, nutritional intake, and other factors. The spread of COVID-19 in India is of great concern due to, first of all, the country's population is huge. It's widespread poverty, high migration rates within the country, high prevalence of chronic conditions, which are generally poorly controlled. Some statistics, global figures, coronavirus cases have passed 170 million globally, deaths have crossed 3 million and recovered 152 million. In India, 27 million coronavirus cases right now, and deaths 322,000 and recovered 25 million. So the Indian health care system has an overview like this. So one thing which is very important is health is a state subject in India, which means it's not a central subject, it's decentralized. So that means that each state has their own call on their health authorities or their health infrastructure. A public-private partnership model exists within the healthcare sector. The private sector is the largest provider of healthcare services and facilities in many states. Private hospitals have been a critical component in the management of COVID-19 cases. So the current scenario being doctors, nurses, and other healthcare personnel are working day and night to serve the patients suffering from COVID-19. Lack of equity. So private hospitals are charging high rates for the treatment of COVID-19 patients. A very dire situation in terms of shortage of medicines, oxygen supplies, and other life-saving supplies. Discussions about a trade-off is continuously going on in the central government and within the state governments between economics and public health, whether to impose a second national lockdown, or whether to impose state lockdowns. That is, whether to save lives or livelihoods. Exponential rise in cases has led to exposure of the flaws within the healthcare infrastructure, such as understaffed public hospitals, lack of a safety net, which means that almost almost 80% of the Indian population are living on the margins of the society, and they lack any sort of health insurance coverage. So the impact of the first lockdown were brutal, of course. So India entered a nationwide lockdown on the 24th of March 2020. Restrictions implemented to control the transmission had unforeseen adverse impacts on health status, access to treatment, and achievement of care goals among people with chronic conditions in India. The impacts of this pandemic, especially the lockdown strategy in the social sphere, is multidimensional. Migrant workers started the long journey back home, as we all know, without any food supplies or provision on transport facilities. This is also, mind you, this also posed to be a serious risk, as these workers could have easily carried the virus into remote and rural areas, which they might have, but we don't know we don't have any data on that yet. Impact on people living with chronic conditions. A recent study has shown that people living with diabetes and hypertension were significantly affected during the COVID-19 pandemic and its related lockdowns. A significant rise in fasting blood glucose levels and blood pressure were reported during the lockdown. So due to redistribution of concentration of health resources and personnel to COVID-19 facilities, people living with chronic conditions have been neglected, meaning that they have been facing inaccessibility in terms of medicines, in terms of insulins for like diabetes patients. So the pandemic caused people with chronic conditions to face many such lifestyle disruptions, such as unhealthy diet, physical inactivity, sleep disturbances, stress, anxiety, which needed remedial measures. Impact on marginalized populations. So the term marginalized populations means these groups and communities experience discrimination and exclusion because of unequal power relationships across economic, political, social, and cultural dimensions. So underprivileged urban residents, especially those of lower educational attainment, or as we know, the urban poor, experience more difficulties in accessing medicines. Rural populations disproportionately experienced acute medical illnesses, difficulties in accessing healthcare, relatively less availability of functioning health facilities, poor treatment satisfaction, reduced fruit and vegetable consumption. So this was not only limited to chronic conditions. Psychosocial and mental health impacts were actually posed to be really dire ill effects. So social and economic issues which result in mass unemployment, depleted social safety nets, homelessness, increased in gender-based violence, alcoholism, hunger, loan defaults, and millions slipping into poverty, which gives rise to a vicious cycle of poverty and ill health. So the post-COVID landscape will lead to an increase in mental health issues such as chronic stress, anxiety, depression, alcohol dependence, and self-harm, as has been seen from evidence from previous pandemics, which have shown a high prevalence of PTSD. So impact of lockdown on gender-based violence, which is a very grave, which is another grave epidemic in sorts of a twin public health emergency, we might say. So these are the numbers, and domestic violence due to lockdown in India, as well as all over the world, like in Spain, Germany, Italy, has emerged as big public health threats. So impact on employment, almost 7.35 Indians lost their jobs in April 2021. Millions of migrant workers found themselves unemployed and miles away from homes, and they started their arduous journey towards their homes. So response to the crisis, how the government of India has responded to the crisis. The Indian government had provisioned a package of 25 billion US dollars. The RBI has taken measures to release liquidity of about $18 billion into the banking system. An additional economic stimulus, also we know it popularly as Atmanirbhar Abhiyan, amounting to 20 trillion Indian rupees, was announced. It was particularly aimed to benefit migrant workers, rural workers, small businesses, street vendors. The reduction in the infection rate has been a huge success for the state governments and the government of India, as we can see now. However, the drawbacks still remain and cannot be overlooked or ignored. So this is a proposed framework which could, which might fit in given the current situation. So currently, the responses to the epidemic in India are based on measures of burden of COVID-19 in a specific area and growth of the epidemic. So a holistic public health approach would also consider other aspects of the situation, like vulnerability to mortality due to COVID, risk of outbreaks, and local contextual factors. So secondly, the health system's preparedness to handle the epidemic, preparedness for basic public health infrastructure, like COVID-19 related screening, contact tracing, quarantining, strengthening disease surveillance systems, providing medical care for mild, severe disease, and deployment of the private sector for the same. Protecting the rights of right to essential health services for non-COVID-19 medical conditions. So WHO emphasizes that essential health services should continue as a means of maintaining public trust, even as health systems grapple with COVID. Thus, the health system's resilience, or the ability to continue providing essential health services, is a key consideration for reproductive care, pregnancy, cancer chemotherapy, and you name it. And lastly, the social determinants of health, the social determinants and the vulnerability to COVID. So people who are living on the margins of the society, and I mean in disadvantaged communities. I mean, with measures such as stay-at-home orders and lockdown can prove to be counterproductive. Social determinants like nutrition are also contributors to comorbidities, like hypertension and diabetes, which add to the vulnerability of those infected. And the protection of socioeconomic rights, which means we should achieve, we should vouch for equity of providing healthcare facilities, and equity for equity for the availability of vaccines and other facilities whatsoever. Thank you. Thank you. That was all.
Thank you so much, Dr. Ognivo Sengupta, for your nice presentations and which is very informative. Yes, nowadays in India, in this pandemic situations, already speaker told that the stress is the main factor, and ultimately this stress also leads any physical inactivity, sleep disturbance, psychological disorder. Exactly so in India, and also the mass employment, which is the main problem in the India. Lack of equity, it is the another problem. Shortage of the medicine and other life-saving drugs. So thank you again for Dr. Ognivo Sengupta for this nice presentations and these informations about this topic. Thank you so much.
Our next speaker is Professor Dr. Subhashish Ganguly.
Welcome, Professor Subhashish Ganguly. Professor Ganguly was a popular teacher and head of the department of D in the Homeopathic Medical College and Hospital. And he has completed his BHMS, MD, and MSc degree from Kolkata. And he is now the MD and PhD guide under West Bengal University of Health Science, Kolkata. He is also a senior teacher. His teaching experience is more than 20 years. And he is also the examiner of Calcutta University as well as West Bengal University of Health Science. I would like to invite him for his presentation. And his topic is there's a most important topic, and this is the need of the hour. That is the precise role of BRYONIA ALBA in COVID-19 second wave. Welcome, Professor Ganguly.
Thank you. Just a minute. Okay. Thank you, Dr. Milan Sengupta, for giving me the opportunity to share my views, though we have worked a long time through webinar. My topic is precise role of BRYONIA ALBA in COVID-19. Role of BRYONIA ALBA in preventive, that is prophylactic, as well as therapeutic. As our CCH, Central Council of Homeopathy, has given us a order through which we should not give our demand that we have cured through homeopathic medicines. So it is called therapeutic approach. And we have already discussed COVID-19, a disease or symptom complex. What are the signs and symptoms, that is clinical features? Fever, cough, general weakness, headache, etc. Loss of smell, anosmia, and diarrhea. Dyspnea. These are very important symptoms. And usually we ask a patient whether he has COVID or not, that have your power of smell is intact or not. And clinical severity and assessment parameter, you know that it has been divided into 3, mild, moderate, and severe. And in case of mild, patients with uncomplicated upper respiratory tract infection may have mild symptoms and without shortness of breath or hypoxia. And in case of moderate, pneumonia with no signs of severe disease. In case of severe pneumonia, acute respiratory distress syndrome. And in case of moderate, when the respiratory rate is equal to 24 per minute, more or equal to 24 per minute. And in case of severe, the respiratory rate is higher, that is more than 30 breaths per minute. And in severe condition, clinical presentation may present with septic condition or septic shock. What are the modifiers? We know that there are different types of symptoms. It depends on stage of the disease, that is COVID-19, duration, how many days he is suffering, first day, second day, third day, 10th day, etc. Age of the patient is very important, and comorbidity. It has already been discussed. Lifestyle, this is very important. You know that we have treated so many patients, or we know so many persons who have comorbidity, but their suffering is mild because of lifestyle. Lifestyle is an important factor. And last point is immunity as a whole. Immunity that doesn't depend on physical body alone, because as health depends, there are different dimensions of health: physical, mental, social, spiritual, etc. So prevention should be done also in different levels. That is physical prevention, mental, spiritual, etc. So immunity is also a holistic concept. It doesn't only depends on physical immunity alone. The major risk factors for severe disease, more than 60 years, underlying communicable diseases, these are already been discussed. So therapeutic approach, signs and symptoms. Signs and symptoms, there are some common symptoms and uncommon symptoms of patient and disease. As a homeopath, we have to know the common symptoms of an epidemic, that is the diagnostic point, and symptoms of the patient. Symptoms of the patient, that is individualistic symptoms of the patient. There are some common symptoms, and these symptoms vary according to the stage of the disease. Suppose in case of first wave, what were the symptoms? And in case of second wave, what are the symptoms? So we have to individualize the disease as well as patient also, and through which we can know the indications of medicines. Now I am going to the role of BRYONIA ALBA. Is it the BRYONIA only have role in beginning or mild cases, or moderate cases, or severe cases, or post-COVID complications? This is the very important question. And these points, the symptoms of BRYONIA have been clearly described by our students from different source books. And from these, we have seen that BRYONIA can produce lung diseases, even inflammation of the lung, that is like symptoms, pertussis like symptoms. So BRYONIA has a very depth of action, not only the upper respiratory tract, but also the lower respiratory tract, even alveoli also. This is very important. And we have already known that great thirst, nausea, and diarrhea, or obstinate constipation, dry cough, fever, chilliness, these are all the symptoms which are found in COVID second wave. These symptoms are produced by BRYONIA ALBA as recorded in source book. And not only that, pleuritis like symptoms, pneumonia like symptoms. Even we know that many of the patients of COVID-19 suffer from tachycardia. And we are astonished that irritable heart, there is a symptom, irritable heart, beating 54 when sitting, but on rising ever so quietly, going up to 110 or 115. So this tachycardia can also be produced by BRYONIA. And what is the role of BRYONIA ALBA in severe cases? In mild cases, they have definitely role, and we have seen that there are so many cases which are treated by BRYONIA, though BRYONIA may not be able to cure those conditions alone, because if we study carefully COVID-19 disease, particularly the second wave, we have seen there is changeability of the symptoms, and there is involvement of the lung fibrosis, and there is coagulation disorder. So if we assess the from miasmatic point of view, it has definitely pseudosyphilitic background. It affects the vascular membrane vessels also. And homeopathic remedies in COVID-19, there is also prognostic factor research. And it also, these research paper also helps us that we are going through a right direction. That is, BRYONIA is one of the very important medicines for COVID-19 in preventive as well as curative. And you know that homeopathic remedies in COVID-19 prognostic factor research, Dr. Rajkumar Manchanda, and it shows that out of 27 COVID-19 cases reported, 211 met the selection criteria for analysis, and arsenicum album, BRYONIA alba, gelsemium, and pulsatilla were the most frequently used medicines. So this supports our BRYONIA alba medicine selection. And if we study carefully the likelihood ratio calculation, you will study likelihood ratio, and Dr. Lex Rutten is one of the pioneers, mostly the pioneers in homeopathic field, who have shortlisted the likelihood ratio calculation for synthesis of this. And dry cough, you know that, for example, among the 211 cases, dry cough, 18 arsenicum album, and BRYONIA alba, 38. So among 61 patients who took arsenicum album, only 18%, 1/8. So likelihood ratio is less than 1. But in case of BRYONIA, 61 patients and dry cough, 38. So likelihood ratio is more than 2. In this way, likelihood ratio is calculated, and it shows that BRYONIA is very effective in COVID-19 like symptoms. And data collection during the COVID-19 pandemic, learning from experience resulting in a Bayesian repertoire. Dr. Lex Rutten has prepared a repertoire which also indicates BRYONIA has a very precise role. And analysis of homeopathic genata epidemicus for COVID-19 patients in Spain. If we study that BRYONIA, arsenic, phosphorus, and gelsemium, whilst those with the best rates of good response. So BRYONIA is one of the very important medicines in COVID-19 cases. And now, post-COVID complications. What is the role of BRYONIA alba? We know that is tiredness, fatigue, brain fag, headache, dizziness, palpitation, chest pain, shortness of breath, joint or muscle pain, depression or anxiety, symptoms gain worse from slightest motion. These are these symptoms when persist for a long period of time, after 1 month even, then BRYONIA has a precise role, because BRYONIA can produce these type of symptoms, and clinically the role of BRYONIA has also been verified. Now the preventive or prophylaxis. You know, the genus epidemicus, according to Hahnemann's guideline in aphorism 100 to 102, he had mentioned that few cases, 1 or 2 cases, and more the cases, more the complete symptoms. So during the first wave in 2019-20, when the symptoms were not fully recognized, but now in 2021, during the second wave, we have the total picture of the COVID-19 has fully known to us. So this is very helpful for selection of genus epidemicus. And what is the general guideline? If we study Cure and Prevention of Scarlet Fever by Hahnemann, he has shown that scarlet fever also has 3 types: mild form, bad form, and worst form, like mild, moderate, and severe case of COVID-19. And he has clearly shown that there are various symptoms according to different stage, different form of scarlet fever. In mild form, there are certain group of symptoms. In moderate form, there are certain group of symptoms, and severe form, there are certain group of symptoms. And he has clearly shown that he has mentioned the term virus in cure and prevention of scarlet fever, though the concept of virus known today was not fully recognized, not fully known during the time of Hahnemann. He has shown clearly that the virus is so extremely communicable that it inevitably penetrates to the most carefully guarded person. And bad type has always the risk of death even after best treatment. So if we determine, if we say that homeopathic medicines can cure all the COVID cases, but our master says bad type has always the risk of death even after best treatment. Now, for prophylaxis, he has clearly mentioned most similar medicine must be the one of the best preventive medicine. Because there are so many medicines, not only the BRYONIA is indicated in COVID-19 cases second wave, BRYONIA, pulsatilla, arsenic, mercury, but most similar medicine or most frequently used medicine should be the best preventive medicine. A remedy that is capable of quickly checking a disease in its onset must be the best preventive. So suppose we have seen that in case of severe disease conditions, pulsatilla has proved its efficacy. 2 to 3 cases. But if we study, if we know that BRYONIA, if is administered at the very onset, then it can check 90% or 80% conditions. Then according to our master, a remedy that is capable of quickly checking a disease in its onset, not at the end or at the middle part, but must be the best preventive. And according to repetition, he has also mentioned clearly according to duration of action or according to the situation. Doses should be age-wise. Diet and regimen during prophylaxis, he has clearly guided us. And antidote in case of prophylaxis. Suppose we have given BRYONIA ALBA 200 or 30 repeated dose to produce an artificial, stronger, similar disease so that weaker natural disease cannot affect our body, but produce some troublesome symptoms. Then there is scope of antidote in case of prophylaxis also. And in case of any injury or mental disturbances, medicine should be repeated more frequently or need few extra doses as required. And Kent has also said his view regarding the epidemic disease. But reality is that many cases, even a year is not sufficient to complete the picture. What Hahnemann had found the completeness of the picture in a few months, but as it is a pandemic disease, you know that COVID-19 has not yet completed even after a year in 2020. Now in 2021, we have come to know its complete picture almost. And therapeutic purpose, that is partial. The reality is there are some partial symptomatology. Patient cannot tell exactly the signs and symptoms. And even when there is no picture of BRYONIA at all, BRYONIA cannot cure 100% cases. So if there is any other symptoms of medicine, that is Rastux, pulsatilla, etc., if we administer BRYONIA, there may be partial result, partial administration. So, and BRYONIA may be indicated in any case, but may not cure and about the disease. Then it requires complementary medicine or series of medicines, even anti-miasmatic medicine. You know, one of our PGT, postgraduate student in DND Homeopathic Medical College and Hospital, he was treated by BRYONIA 200, but ultimately he required sulfur 31 dose. And after that, he was completely free from any symptoms. So our conclusion is that we have to be more scientific as well as artistic. And you know, Dr. Shubhamay Ghosh has clearly mentioned
Sir, your mic is muted.
Dr. Ganguly, your microphone is muted. Please see the matter. Hello. Hello. Hello.
hello, am I audible?
Yes, sir.
Hello?
Yes, sir. You
Yes,
are
sir,
Okay,
now
audible.
you are audible.
Oh, there was disconnection. So, BRYONIA has a definite role, but we have to be more scientific to show the effects of BRYONIA in various stages. So, it requires further study and with evidence. And I want to thank my sincere gratitude to Dr. Milan Sengupta for giving me the opportunity. And I am also grateful to Dr. Pulakendu Bhattacharya, my colleague, for preparing this presentation as also supporting me to deliver this lecture. Thank you all.
Thank you, Professor Ganguly, for your nice presentation, especially on the precise role of BRYONIA and COVID-19 to second wave. It is definitely your presentation is on a strong ground because you are giving so many examples. You are given so many examples, and you are trying your level best to establish BRYONIA in preventive as well as therapeutic level. Apart from this, the BRYONIA effect of BRYONIA in mild, moderate, and severe case of the disease. You also mentioned the morbidity of particular person, comorbidity, and lifestyle disorder. Due to the excessive comorbidity and lifestyle, the immunity may be diminished. And here you mentioned the holistic concept regarding the immunity. Apart from this, you also mentioned the stage-specific action of BRYONIA. Because of that, it has been observed the virus is not responsible for this fatality. The responsible is the dynamics of our immune system. Due to these dynamics, it has been observed there is an unregulated inflammatory conditions going on into our body. And that unregulated inflammatory condition can destroy our body. So it is the high time. If we claim about the role of BRYONIA, it should be always relevant to the virology, because when an epidemic or pandemic will occur at that time, three things are there. Number one, host, number two, agent, and number three, environment. So we can't deny the agent, though the agent is not main factor, but it is an initiating factor. So its role on this area is great because it initiates the disease. And the end product is a structural thing, a structural damage. But dynamics of the disease is very important. Here the dynamics of, especially the severe cases, the dynamics is the unregulated inflammatory conditions. So far, my knowledge, especially for doing some research on virus by the homeopathic medicines, it has been observed that you must mention the pharmacodynamics of your drugs when you are explain your action on a particular epidemic disease. You must mention it. You must find out the role of your drug, the pharmacodynamics of your drug, how much your drug will be effective. Is it effective for all stages of the COVID-19 disease? I think from my part, I can tell you, the BRYONIA may not be effective from all stages of the disease. And that's why, according to you, so many other drugs will be necessary for completing the cure or completing to mitigate the disease. So every homeopathic medicine is stage specific. According to our, if we study every medicine through the source book, we'll get this thing. Every homeopathic medicine is stage specific. A medicine cannot effective or cannot be similar for all stages of the disease. If it is superficial one, the one medicine is BRYONIA is enough for curing the case. But if the disease is in depth position, in deep, so other medicine may be needed for this case. So you can wonderfully explain all these things. Really, I congratulate you to establish the BRYONIA from the pharmacodynamics, from the virological part as your level best, as well as from research part. So I'm very much glad to see these things, that your utmost endeavor regarding this presentation. Thank you.
Our next speaker is Dr. Milan Gupta, President of Homeopathic Education Research and Foundation.
It's a great pleasure for me to introduce our speaker today. Dr. Milan Gupta is an eminent researcher, successful practitioner and faculty of Department of Maitreya Medica in DND Homeopathic Medical College and Hospital. He has post BHMS from University of Calcutta and also completed MD Home degree from Rajasthan University of Health Sciences, and also he was a PhD research scholar of School of Tropical Medicine in Calcutta and awarded prestigious first PhD degree in Homeopathic System of Medicine from West Bengal University of Health Sciences. He is also attached as consultant in Virology Laboratory, Dr. Anjali Chatterjee Regional Research Institute, Calcutta, and also experienced in homeopathy. He has many national and international publications on homeopathic research in mainstream virology journal. Today, his presentation on the topic, a possible role of environmental arsenic against COVID-19. Now, welcome to Dr. Milan Gupta. Please continue your session.
Good evening, everybody. The whole world is now facing a precarious situation since near about 1.5 years regarding the COVID-19 disease. And scientific community, they are trying their level best to control these situations by their own way, and homeopathic fraternity is not beyond it. We know that Department of Ayush already published 2 advisory regarding the prevention, or which I'm telling, especially as immune booster and to mitigate the COVID-19 diseases. And they advised the arsenicum album 30 to combat the COVID-19 cases. After these things, it is our aim, especially through this review research, to find out a possible role of environmental arsenic against COVID-19. 1 minute, please. Slides visible? Hello?
Sir, yes, sir. Yes, sir, visible.
My topic is a possible role of environmental arsenic against COVID-19 in context with the arsenicum album, which is advised by the Department of Ayush, Government of India. Before 20th century, arsenic compounds were the first drug of choice in most of the diseases, and it was a known poison, but it lost its status after development of the modern science. We know that this particular arsenic is important for the different grave disease like that of the acute promyelocytic leukemia, hepatocellular carcinoma, autoimmune disorder, and African trypanosomiasis. In this study, we first observed much less COVID-19 case in some part of arsenic-rich groundwater in West Bengal. Then we aim to find out whether negative correlation between the groundwater arsenic level and COVID-19 incidence present in different parts of the world. We presume in developed countries, it is very difficult to measure the groundwater arsenic, because though in their country, though the arsenic level is high, even that is above the permissible limit according to the World Health Organization, but it is very difficult because they treated that water, and after treatment of that water, they supply those water to their people. Even then, after analysis, we become totally convinced that there is a definite relationship in the areas where groundwater arsenic level are high, COVID-19 incidence is much less. And in many countries, it is lowest compared to the all other areas of the countries. This finding may be the incidental term 1. However, we must look detail into it. Long before 1830, I.L. Crockwood specified the arsenic was a number 1 remedy and which he used in his practice, and that was also used from alchemist laboratory to apothecary's cupboard. Hippocrates used orpiment and regular, 2 arsenic compounds to treat the ulcer. Arsenic was also used as antiseptic and also used as antipyretics in USA in 1950 as Fowler's solution. In China, they treat the tuberculosis and parasitic disease by arsenic. Even syphilis is treated by the arsenic in long time as Salverson's 606. Arsenic compound also used in other different purpose. However, arsenic was used for poisoning, and arsenic compounds showed the teratogenic action. It has been shown in research, teratogenic action on the chick embryo in mice, rat, and hamsters. They also showed the mutagenic action in the allium cepa, and in human leukocytes are known carcinogens. Thus, gradually, the use of arsenic as a remedy was discontinued with the advent of the modern science. However, even today, the arsenic compound is also used for some diseases because it's exceptional results. In case of promyelocytic leukemia, arsenic trioxide is now a choice of drug, and arsenic compounds are now found highly effective in autoimmune disorder, multiple sclerosis, lupus erythematosus, and diabetes mellitus. Arsenic trioxide is also now used in hepatocellular carcinoma and in graft versus disease. It may be admitted that to find out the relationship between the groundwater arsenic and the incidence of COVID-19 cases is extremely difficult, no doubt. This is because most of the developed country, they treated the arsenic in water. However, when we collected data from the groundwater arsenic level and tried to find out the negative correlation between the groundwater arsenic level and COVID-19 incidence, we established a relationship between two. Where there is the arsenic level is high, the COVID-19 cases is low in different parts of the world. Our observation in Brazil, there's a COVID-19 cases is minimum throughout the country, where there is groundwater arsenic level is very high. In Ghazni, Afghanistan, most of the arsenic affluent area, the COVID-19 cases are minimum compared to the other areas. In Victoria, arsenic level is mildly increased and COVID-19 cases is much less than the New South Wales. But it is very, very interesting. In our neighboring country, there is a Bangladesh. It's a well-known country to us. And if we compare with COVID-19 cases in Bangladesh and India, in Bangladesh, the groundwater arsenic level is very high. And in compare with us, their COVID-19 cases is low throughout the country. Our observation also in Cambodia, arsenic level is very high in groundwater. COVID-19 cases is much less in number. In Canada, in Nova Scotia, area in arsenic prone and number of COVID-19 cases is much less than Quebec, Ontario, Alberta, and British Columbia. Similarly, in India and in China, the same things occurs. Where there is groundwater arsenic level is much, the COVID-19 cases is low. In Finland, especially southwest Finland, where the arsenic level is high, the COVID-19 cases is much less than Ushima. In Japan, in Fukuoka, groundwater arsenic level is high, COVID-19 cases minimum in that area. In Mexico, the arsenic level is high, number of COVID-19, the arsenic level is high and number of COVID-19 cases is much less compared to the United States, which is the adjoining country. Nepal is also an arsenic prone area, we know, like Bangladesh and West Bengal, and Rupandehi area of Nepal contains large amount of arsenic in groundwater, and COVID-19 cases in Nepal is still much less. In Pakistan and in Taiwan, we observed the same scenario. So, arsenic trioxide, you know, our arsenical album is produced from the arsenic trioxide. It is a main ingredient within this medicine. The arsenic trioxide is not only rapidly absorbed toward the intestine, but it can also be easily absorbed through the lung and skin. In blood, they easily bind to RBCs. Arsenic trioxide react with the cysteine and modulate protein kinase C, NFKB, and mitogen activated protein kinase. Arsenic trioxide can also modulate the cytokines, interferons, autoantibodies. Arsenic compounds can also, this is the most important findings. The arsenic compound can act as an immunosuppression without affecting the components of immune system. Although Hang et al., it is a preprint publications, but I think it is already published, mentioned the possibility of arsenic trioxide as an inhibitor of angiotensin receptor 2. You know, this angiotensin receptor 2 is a receptor which bind with the COVID-19 virus, and virus gets entry into the body. The role of nicotine in modulating the AC2 receptor is known, and although still controversial, but it has been observed in cigarette smokers. They are lessly affected by the COVID-19 cases. But we know in cigarette smoke, there is a nicotine, and that nicotine, within that nicotine, there is a high arsenic. So the role of arsenic may also be present in this aspect. Pulmonary exposure of arsenic is about 10 mg per day in smokers, while in non-smokers, it is 1 mg per day. Again, arsenic and phosphorus are both group 15 elements. Enzyme producing phosphate esters can also participate formation of arsenate esters. However, arsenic esters are less efficient than the phosphorus esters in their biological activities. Arsenosugar, arsenolipids are also known, and arsenic can remarkably diminish rRNA, leading to death phase of organism. It has also been suggested that arsenic may replace the phosphorus for many biological functions, and it can offer the redox potential conversion of arsenate to arsenite. If we analyze all these biological activities, then this also indicates the arsenic should have a role against COVID-19. Again, if we look back 90s in England and Wales, there was an epidemic of arsenic poisoning, which is known as the English beer poisoning. And if we look into epidemic of influenza from 1847 to 1890, there are few cases, but in between 1890 to 90s, there are 3 epidemics which decreased abruptly in 90s, and that may be due to the English beer poisoning, indicating a possible link of arsenic poisoning and decline of influenza. Thus, considering all these features, we may conclude that a possible role of arsenic trioxide, our arsenic album is produced from that, may be that to prevent or mitigate the COVID-19. It is our utmost request. It is not, we are not claiming it. We not claim it. It is our utmost request to all scientists of the globe to look into this matter for the benefit of tormented humanity. It is important to note that the analysis should be done in the area-wise country. Country-wise data analysis will not show a statistically significant correlation between the arsenic level and the COVID incidence. This is the arsenic level and COVID incidence in different parts of the China, and number of COVID-19 cases and possibility of arsenic contaminations in China, just to see there. And this is the arsenic level and COVID-19 incidence in the world, the areas with high arsenic issues, the locations by number of confirmed COVID-19 cases, just to see there. And this is the most important area. This is the most important area of our presentation. That is the immunomodulation of arsenic. We know that arsenicum album 30 is used as preventive for combating that COVID-19 in our country as per direction of Ayush. The positive preventive role of arsenic ALB in COVID-19 cases has been reported from different parts of the country with some failure and controversy. In that context, our aim was to find out the exact role of arsenic in COVID-19 cases. Actually, arsenicum album 30 produced from arsenic trioxide, remember it, and arsenic induced significant reactive oxygen species. Just to see here, ROS, that is a reactive oxygen species. So arsenic induced significant reactive oxygen species generation mainly through the mitochondrial electron transport chain. Activation of nicotine adenine diphosphonucleotide oxidase also contribute to the generation of superoxide anion. Additionally, arsenic metabolism leads to the generation of ROS in cells. The role of ROS participating in antiviral host defense is considered. The function of ROS in the antiviral defense is assumed to be mediated by the apoptosis, that is a programmed cell death. It is suggested to be mediated by, it is suggested that a cell activates generation of superoxide and hydrogen peroxide by xanthine oxidase as well as intracellular NADPH oxidase in response to the appearance of a virus in its cytoplasm. Increased ROS level turns on the process of programmed cell death in the infected cells. So the infected cell and its neighbor, which are most likely to be infected, are eliminated, thus blocking the spreading of viral infection. So it is our proposed model. It is our proposed model, especially regarding the immunomodulation of arsenic in COVID-19 cases. It is my request to all scientists of the globe, please look into the matter to save the suffering humanity. This is the reference. This is the this review research article was virtually presented and published in the International Conference of Japan Geoscience Union and American Geophysical Union on May 24th to 28th May 2020 as poster presentation. I'm grateful to my principal investigator, Professor Das and Dr. Chakraborty for their utmost support. Thank you, everybody.
Thank you, sir, for your nice and precise and informative presentations. Actually, sir, in your presentation already you told that CCH recommended the arsenicum album as an immunobooster. Your presentation, the immune modulation of arsenic, this is very important part, I think, because already we know that the arsenicum album act as an immune booster, but how arsenic act in this COVID situation, or what are the exact role in the COVID-19 arsenic, what are the exact role? So nicely, I think in your presentation, this immune booster is not a perfect word. I think it is a immune modulation is the perfect word, because immune modulations are regulatory modifications in the immune system. So it is, I think, in respective immune booster, the immune modulations, because the arsenic at first produces the mitochondrial ROS productions, that means the reactive oxygen species, and ultimately this produces the programmed cell death, that means the apoptosis, and viral can act specially on the virus through. Sir nicely explain the immune modulation of the arsenic, and it is clear how arsenic acts or what are the exact role of arsenic in the COVID-19. Thank you so much again, sir, for this nice presentation and informative presentation. Thank you so much.
At the end of the session 2, I would like to call Dr. Milan Sengupta for conclude the total webinar.
Well, we have arrived at the end of our journey, especially this webinar. Thanks to our chief guest, Professor Dr. Subhash Singh, our special guest, Professor Sonali Sengupta, our guest of honor, Dr. Shivendu Ranjan. And I again offered my thanks to our respected speakers, Professor Shubhamoy Ghosh, Professor Subhashish Ganguly, Dr. Ognivo Sengupta, and my beloved students, those who are presenting the basics of BRYONIA, Rishita Ghosh, Diptangshu Kushari, Shoham Chattopadhyay, and Smita Bhobi. I also offer my gratitude to all the participants in this webinar, our respected doctors, our faculties of different homeopathic colleges, government and non-government, researchers, academicians, and also those who are helping us in this webinar and also present in this webinar. My gratitude and love to everybody, especially my team, those who are tirelessly work to make this webinar success, and especially behind the curtain, Rishita, that is Diptangshu, Shoham, and Smita, and Shomen, as well as Ongshuman, etc. Many thanks to the technical advisor, Mr. Shuprakash Vishwas, for helping nicely from behind. Thanks to everyone for attending this webinar, and we are also we want your help in future for the same type of program. Thank you, everybody.
At last, an announcement for all. Mementos of this beautiful webinar have been arranged for all the speakers of this webinar. As soon as this pandemic situation is over, we will arrange to send it to them, and we hope that you will be by our side in our next step. Stay home, stay safe. Thank you.
Thank you, everybody.